I think the three things I always think about is early detection actually does matter. There are all these low-hanging fruit around brain health and managing symptoms that we really want to emphasize. This is an active process, and planful detection is active and matters. The other, I think the takeaway that we were talking about earlier is just what brings us to the surface if we're not doing a screening approach, and realizing that behaviors and more functionally apparent symptoms are really what's bringing it to the forefront. And so having symptoms responsive to that are important in just areas of big need. And then finally, that breaking up everything is really perhaps a feasible way to do it. And I think that really speaks to your team-based approach, which I do feel remiss in not talking enough about. But so little of this has to be that MD or DO, NP, PA, primary care provider. And so I totally agree that a system that's doing it planfully and can find a way to bring in the team has ample opportunity to make this a team effort. Absolutely.
Mm-hmm. Great. Dr. Gibbs.
Yeah, thank you. Yeah, sorry, 3 takeaways.
Takeaways.
Well, also just to acknowledge the work of primary care. And I like the word planfulness, and really being pensive about not trying to tell or force primary care to just adopt something else, right? It's hard work to be a primary care clinician. And, we know since post-COVID, like the inbox messaging is over 150% of what it was. I mean, this is really, has to be done carefully. But I do think that it's in the realm of primary care. I mean, right now, the lifestyle is so important for the prevention and the whole person brain health plan, whether it's exercise, community engagement, and all of that. I mean, primary care clinicians are the experts in that. So this definitely fits into the realm of primary care. And also, I just, I'm getting away from my takeaways, sorry, but I realize as well that, as science develops treatments or possible treatments, primary care clinicians are going to be on the hook for knowing about those, and the patients will be coming in asking, am I a candidate for this? So organically in the scientific community, it's going to push forward, and we need to be prepared to deliver these toolkits and these approaches and everything else. But my quick takeaways, again, I agree, team-based care. I think the annual wellness visit is one successfully to promote this. And again, I think it's just natural to be in the realm of primary care at this point, and agree with your comments about allied health professionals. I mean, if you're a solo practitioner in an office, absolutely, we can use as much help as we can, whether it's a speech therapist, physical therapist, make them part of your team. So I'll stop there, but thank you.